Hey guys, welcome back to my channel. So I've decided to start a mini-series type set of videos, and they're going to be called Autism and ... Each episode or video is going to be another and. So the first video I'm going to start off with is Autism and Therapy. And I decided to do these videos because I got a lot of views on the Autism Part 1 and Part 2 stories, and my channel name is Towards Autism, so I thought I'd do a set of videos with more information about autism. Now, if you watch the autism videos, I touched on all the topics in this series I touched on, but I'm going to go more in depth with each video on the certain topics. So the first one, like I said, is going to be Autism and Therapy. I thought I'd start with this one because therapy is a huge part of our life, or Bub's life. Unfortunately, not all kids get the therapy they need because of the state they live in, their insurance, getting the services. It's a hard thing, so we're very grateful that he gets all the services he gets. So, therapy. Technically, Bub actually started doing therapy, was at 10 months old in October of 2015. He saw a occupational therapist because if he crawled with his fists, with a closed fist instead of, open on his hands. Looking back on it now, it was definitely a sensory issue. He was only in therapy for about a month and a half. He was only 10 months old, there wasn't much to do. Fast forward to 15 months old, he started early intervention, which is a program. It could be called different things in different states. Early steps, early intervention, early something. It's usually started with the word early. And that goes from birth to age 3. And that could range anything from physical therapy, occupational therapy, speech therapy, behavioral therapy, any really kind of therapy, and it's usually done through the state or through your county. Bub started his early intervention at 15 months old, and he started with a play-based therapy and occupational therapy. Once a week for each, 1 hour a day. It was on like Wednesdays and Friday mornings, I would say, from 9 to 10 in the morning, or 9:15 to 10:15. It was very early, very hard to do those sessions. I was still working at the time, so I would get up, do therapy with him. He was very unwilling. It was too early. And I would go to work. So that was the first set of therapies he had. And shortly after he started that, he was diagnosed with autism, and he stayed with play-based therapy and occupational therapy until he was 3, until early intervention was over. We added speech therapy around October of 2015. He turned 3 in December of 2017. So in the course of about 2 years, he had 3 speech therapists through early intervention. And we also added behavioral therapy. Can't remember exactly when that was. I want to say that was the beginning of 2017 we added behavioral therapy. But in the course of the between 15 months and 3 years, he had a couple days a week therapy, 1 hour each time. Early intervention is usually about an hour. Early intervention therapy from 15 months to 3 years old. By the time he turned 3, he had early intervention, which was at home almost every day. He had Mondays were the only days he didn't have it. Tuesdays he had play-based and speech. Wednesdays he had occupational. Thursdays was speech, and Fridays were behavioral, I believe. It's hard to remember, and it was just 7 months ago. So, breaking down what he did in those therapies really quick. So behavioral therapy, at least with him, obviously it's different for every kid and how every kid interacts with a therapist, and that's a big part of how things are done is depending on each child. With Bub, the behavioral therapist would come, just kind of push his buttons, force him to interact with her. She'd play with toys he was playing with, make him engage, wait for a bad behavior to fix it. He really doesn't have bad behaviors. He's a pretty well-behaved kid. I mean, every kid has their issues, and of course he has meltdowns, which doesn't help things sometimes. Special instruction therapist, which is his play-based therapist, she would literally just bring toys and sit and play with him and just engage with him and get him to follow directions. The occupational therapist did a lot of food therapy with him at the beginning because he has a lot of sensory issues. The occupational therapist mainly did a lot before he turned 3 with sensory issues. Sensory and feeding were the main things that they worked on. And then speech, we really didn't have a lot of success with early intervention speech as far as getting things done, but it was singing songs, trying to identify letters, just pointing to letters and, oh, this is an A, just kind of things like that. We had 3 speech therapists in the course of like a year, so we really didn't get a lot done. And then in September of 2017, right before he turned 3, we started a food therapy that was supposed to address his feeding issues, sensory issues, kind of like an occupational therapist, but also a speech therapist combined. The two of them would work hand in hand. Speech would work on the oral portion of eating, and the occupational would work on the sensory portion of eating. We've been in that for almost a year with ups and downs. We weren't sure if we were going to stay in the program a few months ago. They really strayed away from anything sensory. We didn't do anything feeding, and at first they tell you we're not going to sit down and force feed him, which obviously I don't want to do. We also strayed away from sensory, and we weren't getting anything accomplished. So after a sit down and a discussion, we have gotten back into sensory. Not so much feeding, and I feel like feeding for him is just going to come when it comes. We've been doing a lot of preschool-based sensory, arts and crafts, things like that. They did a lot, when he first started, did a lot of water play because he was comfortable with that, and they wanted to build trust with him. So when he turned 3, early intervention was over, and he starts a program called Intermediate Unit, which the IU is the next level up from early intervention. Technically, they recommend sending the kids to the special needs preschool right after. I didn't believe he was ready. Well, not just me, but we didn't believe he was ready. We decided to hold off on sending him and do his IU therapy at home, where after the holidays he had a teacher just kind of come and do crafts with him, kind of a little bit of everything, because it was a therapist that would be the teacher in the classroom, a speech therapist, an occupational therapist, and a physical therapist. He also started doing outpatient services for speech therapy, outpatient services for physical therapy. And so currently, which we started in January and up to now, Mondays he has a half-hour speech therapy followed by a half-hour physical therapy, so an hour of therapy at an outpatient facility. Tuesdays, when school's in session, he would have the intermediate unit therapy with the teacher for 30 minutes. Wednesdays was occupational therapy through the intermediate unit for 30 minutes, and then food therapy or feeding therapy outpatient for 45 minutes. Wednesday, speech therapy through the intermediate unit for 30 minutes, and then 30 minutes of speech at a different outpatient facility. Friday is feeding therapy for 45 minutes at an outpatient facility, and then physical therapy at home through the intermediate unit. It sounds like a lot, but it's only a few hours a week once you add it all up, because a lot of the sessions are 30 minutes. So we originally started the IU, the school-based therapy, at home because we opted to not send him to actual preschool. He got very lazy about doing it at home. Home became more relaxed than therapy-based because most of his therapies were outpatient at this point now and not every day at home. So he stopped participating, and around April-ish we moved to the actual school he'd be going to, but with in an office setting, one-on-one, not with the kids in the classroom. Now it's kind of hard to explain. So the classroom is just kids with special needs, and there's only about 4 or 5 of them. And then there's a 3 to 4 year old group on Tuesdays and Thursday mornings. Monday, Wednesday, Friday is a 4 to 5 year old group. And then there's also a 5 year old group in the afternoons, I believe, on Monday, Wednesday, and Friday, that is mixed with special needs and typical kids to prepare 5-year-olds for kindergarten. Around the end of May, we decided to continue his 30 minutes on Tuesdays and Thursdays of therapy, but mingle him with the kids that would in the classroom to kind of prepare him, because he will be going to the school in the fall. It's a big schedule. Once he's in the classroom as a student, he's with the kids and it's just the teacher and the aide, and then he'll have his therapy sessions mixed in at whatever time they decide to take him to do his private sessions. It's a lot. It's very confusing if you don't understand, but it's just routine for me. Physical therapy, we're pretty much graduated out of physical therapy. He really didn't have too much jumping in place. We've accomplished forward jumping, we've accomplished climbing up and down stairs. We don't have stairs here in our house, so that was something that he just couldn't learn because of our accommodations at home. So climbing up and down the stairs, holding the handrail, switching feet when he climbs up the stairs, jumping forward, balance beam. The main things he can't understand are throwing and kicking a ball. But those are the kinds of things that it's kind of whatever. He rides an adaptive special needs bike at therapy. He does a lot, but it's not long days. It's 30 minutes, hour, then we're done for the day. There's been a lot of improvements with him being in therapy. He has a busy schedule, but he needs to stay busy. If he has too long of a break, you know, therapists are on vacation, things get canceled, holidays, summertime, things like that, he starts getting lazy. He starts kind of forgetting his routine. He's good with outside of the home therapy. At first, it was a struggle for him because he didn't like getting up and doing anything, but now home therapy has been a struggle, and it gets him out of the house. If we sit at home on, you know, on a weekend day, by 11 a.m. he's asking for the iPad. When we have therapy, sometimes we can hold off. Some days he's on it early, some days I can hold off and wait till after dinner. A lot of people don't believe in technology for their kids or letting their kids on technology or iPads. I don't like my daughter on it too much, but she understands if I say, no, you're not going on it right now, go read a book, go play with your toys, you're not going to sit on your tablet all day. I really can't explain that to him. He doesn't understand why. He has no concept of why he can't do something. In his mind, if he wants something, he should be able to have it, and he doesn't get explanations why. He doesn't comprehend that. So there's no negotiating with him, for one. For two, he's not a typical kid. He doesn't like too many toys. He doesn't play outside. He doesn't care. He will play outside, but not for long. He gets bored. But he's not sitting zoning out like a zombie on his tablet, he puts on clips of shows and he's playing and walking around and moving while he's doing it. So it's kind of background noise, but he gets very engaged and he's playing with things, and he's not just a bum on the couch. So I'm not as concerned because he is busy during the day with therapy, so it's kind of his break to unwind. There are many different types of therapies. He also has a behavioral therapist, but she sees him about twice a month, and it's kind of just it's mostly her and I talking. A one-on-one, how's he been doing, how's he been sleeping, how's his behaviors, is there anything that's changed, is he on any new medications, things like that. Not really so much her to him. It's more facilitating. She'll give me tips on how to take care of certain situations. There's behavioral, or there's a therapy called TSS, which it's kind of like a behavioral therapist. It's getting them to engage a lot, cause and effect type things, but it's at home, and they like to do it for like 2 hours at a time, and it's just not fitting on our schedule right now. But they also can help at, after school with homework and doing chores and things like that. So that would be something like that would be helpful as he gets older. Another therapy that is kind of controversial, some people like it, some people don't, it's called ABA therapy. It's life skills. Now right now there's no life skills he needs to learn, but as he gets older, potty training, which his behavioral therapist can help with that, but potty training, or as he gets older, vacuuming, bathing himself, changing his clothes, taking out the garbage, loading the dishwasher, it is based on age. There's a family channel that I watch called Fathering Autism on YouTube, and their daughter is 12 with nonverbal autism, and they do a lot of ABA, and it's age appropriate ABA. Right now he's 3, so there's not much an ABA therapist would do with him that would call for an ABA therapist, at least in my opinion. I'm not opposed to any therapies as long as it is not overwhelming for him to the point where he can't function. Obviously, you need to push his buttons, you need to force him to do things. He's very stubborn, and he knows what he can and can't get away with, and he pushes that. He also doesn't care what you have to say or what you want to do. If you don't want to do it, he's not gonna. So sometimes I have to be there and help push him. I'm not against any therapies. I obviously do what I think is best for him. And if that means he has therapy every day, then he has therapy every day. I don't want to sit at therapy for 6 hours a day. I don't want to be having someone at my house all day long. I like to have my own time to do things and not have someone at my house just watching me. So I let him live his life also. He shouldn't be overwhelmed with therapy, because you push him too hard, he goes backwards. He starts not cooperating. So there's a fine line with him, and I think right now we're good with it, and then he'll start school and we'll see if we need to change anything to his routine, because 2.5 hours at school is going to be a lot for him, but I think he'll be able to handle it more than he could in the past few months. I think he's matured a lot and is more prepared for school than he was originally in January. So he'll be starting school, like I said, in September. So he'll be just shy of 4. Because of his late December birthday, he won't start regular kindergarten until almost 6. If he starts on time and we don't postpone it, which I don't feel that we're going to, but if we did, it would be 6.5, almost 7. I don't think that's necessary, but we don't know what the future holds as far as him and his learning, so we'll play that by ear. But so as of right now, he would be starting kindergarten in about 2 years. So he'll go to the special needs school for 2 years, and than a regular kindergarten, probably with special needs aides or whatever needs to be done. Biggest advice I would say so far, if your kid doesn't click with their therapist, don't push it. If after a few weeks there's nothing positive coming out of it, Bub's first speech therapist we had for about 5 weeks, so 5 sessions, and he cried every time she showed up. He wanted nothing to do with her. He crawled on the couch and fell asleep during one session. And every time she showed up, he'd be crying, and I'd have to come up with some excuse why he was crying, because I didn't want to say he don't like you, but he didn't like her. And finally, after 5 weeks, I'm like, this is pointless for me, pointless for him, pointless for her. Everybody's wasting their time. So I contacted his social worker through early intervention, who was amazing. And I was like, listen, this isn't working out. She goes, that happens. Some kids and therapists don't click. Some therapists aren't meant to work with some kids. That speech therapist was not meant to work with younger kids. I had heard through his other early intervention therapist, and like I said, that's for under 3, that a lot of families asked to get rid of her or asked to change therapists because she seemed better with older kids. And that's just how some people are. I mean, some people aren't great with young kids. And that's fine. I just don't want you working with my child if you don't know what you're doing. So it just all is trial and error. But never feel obligated to stick with a therapist because you feel bad for firing them, because you're not firing them. You don't have to even do it yourself. You have your service coordinator cancel for you. You have their boss cancel for you. You don't have to do it, but don't feel bad because if you have to, because you don't want to waste their time. You don't want to waste your kid's time, and you don't want to waste your own time. To have your kid cry every time the therapist shows up, it's like, why am I having somebody come to my house that's going to upset my kid, that has to teach my kid and work with my kid? He's not going to learn anything from you because he doesn't like you. We've been through a lot with therapists. Luckily, we haven't had to get rid of more than just the one, but we've had a lot of turnarounds, and with him turning 3, we've lost ones, gotten new ones, and it's hard when, you know, therapists go on leaves, maternity leaves, vacations, things like that. You get a lot of substitutes. Right now, his OT for feeding therapy on Wednesdays is going to be going on maternity leave in about a month and a half. Don't know how long she'll be out, at least probably 6 weeks, so at least 6 sessions. And who knows who we're going to have, if we're going to have our Friday therapist work with him or somebody new. His behavioral therapist is due in the late fall, winter. Luckily, she only sees him about 2 times a month, and she doesn't work directly with him, so that's not going to be an issue. But and sometimes they quit or they switch jobs. His second speech therapist we lost because she got a job in a different county and couldn't keep her kids. There's a lot of turnaround, especially with county employees. It does make it difficult because sometimes your kids click with some therapists and then you lose them. I feel like if his speech therapist, the second one, didn't get a new job and had to leave, I feel we would be more progressed because he clicked with her on the first day. So it's hard because you get attached to them because you see them once a week, twice a week, you know, especially when they work with you in the home. They kind of know your life. They know your family sometimes. I always gave his therapist, especially through early intervention, like Christmas gifts, little gift baggies. In this past December, since they were leaving him pretty much for good, they were, you know, I gave them thank you bags / Christmas, Merry Christmas bags. And obviously I'm not forced to do it, but I enjoy doing it because they work with my child, who sometimes can be super duper complicated and frustrating to work with and stubborn and grumpy, and they push through it. And we don't see progress every day, but when you add it all together, a lot gets accomplished when you look back at how he used to be 6 months ago or a year ago. It's just little pieces all adding up to a change. So this is the first episode of my Autism and series. Stay tuned for my next video in the series. I'm not entirely sure which one it's going to be. I have a few listed here on my phone, but I'll see you in our next video. Bye. Bye.